St. Vincent and also Arkansas OB/GYN Association. Good to have you here.
Thank you for having me.
This is the month when we try to raise some awareness for cervical cancer, right?
Yes. Cervical cancer is a very preventable disease. We have very good tests that can screen, identify it early before it progresses to cancer, and we have very good treatments available.
That is good news, good news. Well, we're going to talk about more of that. Let's get to the phone lines and see what they want to ask you about. And Mary is up first from Big Flat. Hi, Mary.
Hello.
Hi. What's your question?
And I want to know if it is true that cervical cancer was designed to take 10 years off of a person's life.
No. No, Mary, I don't think it was that designed.
Design probably isn't the word, but
right.
Is it considered to take 10 years off of a life?
No, and this is the thing about cervical cancer. They're very good. It's usually related to the human papillomavirus. We have very good tests now where the pap smear is a very good screening tool. So if you are getting your pap smears regularly, if there's a change, then we can identify that and treat it before it ever progresses to cancer.
And that's why early detection is so important.
That's right.
So if it's detected early, treatments are received, that person can live as long as their life expectancy.
That's exactly right.
Very good. Okay, so no is the answer to that myth. Thank you, Mary. Frida is up next from Conway. Hi, Frida.
Hello, how are you?
We're doing great. Go ahead.
Well, I wanted to know, several years ago in 1988, I had a fibroid tumor that got the size of a large watermelon. Do I need to have a pap smear? I'm 73.
Okay. And did you have a hysterectomy because of that?
Yes, I did. I had a complete one.
All right.
Okay.
And this is a very
Dr.
good
Mo
question.
Smith did my surgery at St. Vincent.
Oh,
okay,
good.
Good.
This is a very good question.
Yes, it is.
They are saying now the American College of OB/GYN came out with these new guidelines probably about a year ago, and they were talking about that women who have had a hysterectomy for benign reasons like Frida, for fibroid tumors or heavy bleeding or pain, and if they had always had normal pap smears before, like for 3 years previous to that hysterectomy, they do not need to get their annual pap smears anymore if it was for benign disease.
Okay.
Also, they're saying that typically for American women at around between the ages of 65 and 70, most of them can stop having their pap smears if they have all been normal before. But you do need to check that out with your doctor. And it is important to note that women do need to continue to have their annual exams, because even as we age, you know, the breast exam is important. Talking to them about osteoporosis in that age group and other cancer screening is very important.
For many women, that is their annual physical
That's
sort
exactly
of,
right.
And they can find out a lot of other information too. Okay, let's get to Ann, who's on the line now. Good morning, Ann.
Hello.
Hello, go right ahead.
Yes, my daughter is married and lives far away, and she went in for a regular physical earlier in the summer for her yearly exam, and the doctor there, that was a new doctor, said that she had a cervical polyp, and it required not inpatient, not at the doctor's office, but that she would have to have a surgical outpatient procedure to remove it because it was so large. And then later, her insurance kicked in where she was working, and she went to a doctor that was with her insurance, and that doctor said, gynecologist said that no, that everything was fine. She didn't need to do anything about it. And we're just wondering, does she need to get a third opinion, or should she be concerned, and what we need to do?
Okay.
Yeah,
that's a very good question.
Yeah.
Typically, and how old was your daughter?
You still with us, Ann?
Okay.
I don't think she is.
All right.
She's married. So
I think it's probably 30s or so.
Okay.
20s, 30s. Typically, a true cervical polyp are most often benign, okay? I guess it depends on how big it is, and apparently one doctor thought it was larger. It may have regressed a little bit by the time the second doctor saw it. So if that's a concern to her, then I would certainly say perhaps check it out with another doctor, and be sure to relay that concern. Say, one doctor said this, one doctor said that. I'm not sure what to do. And they can usually say, well, it appears to be this size, which is small, benign. And certainly if it's causing her any trouble, i.e. Perhaps some breakthrough bleeding after sex, anything like that, any pain, then they could easily remove that, but they're most often benign.
Yeah, so go see another doctor until you are comfortable with the answers that you're getting.
That's exactly right.
Well, I know you just wanted to talk about early detection. There are so many treatments out there now to stop this early.
There are.
Yeah.
And so the important thing is it's related to the human papillomavirus. There's actually prevention for young children now. They have a vaccine for girls and boys. They're recommending that between the ages of 9 and 26. And then also, it's very important if women will just get their pap smears, see their doctor regularly, every year, every 2 years. If you're over 30 and have had all normal, now they say you can go back to every 2-year screening as pap smears. But if you will follow up with that and get that, especially when you're young, between the ages of 21 and 29.
Right. Get on the routine of doing that.
That's
and do
exactly
it every year
right.
or two.
Then that can help prevent a lot of the later invasive cervical cancer.
Exactly. Well, we want to thank you for coming. Great
thank you for
questions
having
out
me.
there and great answers. Let's put up the information, of course, about Dr. Gailey. If you'd like to call for an appointment or to ask any questions, of course, Arkansas OB/GYN Association. She is also affiliated with St. Vincent. There's the phone number and some more information on times that the office is open. Thank you so much for coming.
Thank you for having me.
You have a great month. January is our awareness month, so it's good to have you here, Dr. Lee.
Thank you.